afternoon, everyone, and welcome to today's Public Health Ontario Rounds presentation on climate change and health equity. My name is Elena McIntyre. I'm the Manager of Toxicology and Exposure Assessment within the Environmental and Occupational Health team at Public Health Ontario. And today I have the pleasure of moderating our session. Before we get started, just a few housekeeping items. The chat pod has been disabled to limit any distractions during this presentation. So we please ask that everyone use the Q&A pod if you have questions or comments during the session. We have reserved some time towards the end for a question and answer period. If at any point during the session you experience technical issues, please do email our team at capacitybuilding@oehpp.ca. They will do their best to help you troubleshoot. And as moderator of today's session, I would like to state that I have no conflicts of interest. Now, to move on to our speaker, it's my pleasure to introduce Rebecca Schnitter. Rebecca is a Senior Policy Analyst with the Public Health Agency of Canada's Infectious Disease and Climate Change Program. Prior to working at PHO, she worked in Health Canada's Climate Change and Innovation Bureau, where she was the co-editor of the National Climate Change and Health Assessment Report and lead author of the chapters on health equity and food safety and security. Rebecca is currently completing her PhD at the University of Alberta's School of Public Health, where her research focuses on the intersection of climate change adaptation and health equity. We are delighted to have her here with us today to present her work. Rebecca, I will hand things over to you.
Great, thank you very much. Good afternoon, everyone. Before I get started, I just want to acknowledge that I am located in Victoria, BC, which is on the traditional territories of the Lekwungen-speaking peoples, the Songhees and the Esquimalt First Nations, and I'm grateful to live and work on this land. So I'm happy to be here today to discuss climate change and health equity. I'll be discussing the different linkages between climate change and health equity, focusing specifically on climate change vulnerability and climate change adaptation. I'll provide an overview of tools and resources that can help really center health equity into our climate change work, and provide some examples of adaptation measures that promote health equity and reduce the impacts of climate change. So in February 2022, Health Canada released the National Climate Change and Health Assessment, which was really the first comprehensive climate change and health assessment in the country since 2008. The report provides an assessment of the latest evidence and knowledge of current and projected impacts of climate change on human health and health systems. And it discusses who is most at risk to these impacts. It outlines the current status of adaptation in the country, including a number of case studies of effective adaptation measures implemented by health units and health facilities, and outlines existing research gaps and knowledge needs. So my presentation today is going to focus on the key findings of the chapter on health equity, but certainly encourage you to check out the report if you want to learn more in general about climate change and health. So the national assessment found that not only are impacts already occurring, but health risks will increase as warming continues. So the greater the warming, the greater the health risks. There are a variety of climate hazards that impact human health through direct and indirect pathways. And these risks are mediated by a number of important social dynamics and characteristics, many of which are related to determinants of health. And so these can really influence the magnitude and the severity of health impacts that individuals experience. And because of this, the impacts of climate change on health are not experienced in the same way, and they can disproportionately impact some populations and communities. I'm sure this is familiar to you, but let's just remind ourselves what we mean when we talk about health inequities. So health inequities are avoidable, unfair, and unjust differences in health. And in many cases, health differences, they're not random, but we do see them patterned across populations. They're the result of how societies distribute resources, power, and opportunities, and often a result of lasting colonization, discrimination, and racism. The statistic on the slide here illustrates this point, where we see very different life expectancy and infant mortality rates for Inuit versus non-Indigenous Canadians. So getting right into the first key message of this chapter. So evidence suggests that climate change can exacerbate existing health inequities and widen disparities. And structural systems of oppression that result in health inequities are in many cases underlying drivers of vulnerability to climate change. And so it can be a little difficult to conceptualize the intersection of climate change and health equity because of its complex nature. So this framework was developed for the chapter to really help illustrate where and how climate change and health equity are linked. And I'll walk through it just very briefly. So you'll see drivers of inequity at the top in yellow. These are upstream drivers that include social and cultural systems and structures, political and economic systems, and structural racism and historic and ongoing colonization. So these structures result in the unequal distribution of money, power, and resources. And this influences the status of an individual's determinants of health. So for example, high versus low income, high quality housing versus low quality housing, food security versus food insecurity. And these differences in determinants of health can give rise to health inequities. As we keep moving down the framework, we see that the determinants of health and health inequities influence climate change vulnerability because of their impact on an individual's exposure or sensitivity to a climate hazard and one's adaptive capacity. So for example, the risk of injury during an extreme weather event is increased for individuals who live in substandard housing compared to those in quality, safe housing. And this is because they can be more exposed to the hazard. And this, of course, has implications for community and individual health and well-being. The green boxes on the right indicate the linkages between climate change adaptation and health equity. So adaptation measures themselves can interact and impact determinants of health and influence climate change vulnerability, either in a positive or a negative way. And adaptation measures also present an opportunity to address underlying drivers of health inequity and climate change vulnerability. And I'll provide examples of this a little later in the presentation. But first, I want to focus just a little more on the linkages between determinants of health and climate change vulnerability. So as I mentioned before, health risks and impacts are not uniform across society and communities. So evidence suggests that differences in exposure, sensitivity, and adaptive capacity can result in some people being more severely affected by climate change. And the graphic on this slide attempts to illustrate the various identity factors and determinants of health and how they can influence health outcomes related to extreme heat. So the three rows colored in shades of blue, those are elements of vulnerability. So exposure, sensitivity, and adaptive capacity. And you can see that there are factors in each of those rows. A red square indicates a risk factor and a blue square indicates a protective factor. And then you'll see the red row along the top indicates the health risks related to extreme heat. And you'll notice that those health risks are different for each individual. So this is really just highlighting how complex climate change vulnerability is because the risk factors and the protective factors really differs for each individual. And so as research continues in this field and as the understanding of climate change vulnerability evolves, we see increasingly the importance of taking an intersectional lens to understanding climate change vulnerability. And so including considerations of how multiple existing inequities can interact, shape, and compound experiences and responses to climate change. So despite this, most of what we do know about climate change vulnerability comes from research that looks at broader population groups. So in terms of who is at highest risk of climate-related health impacts, we know that in many cases, First Nations, Métis, and Inuit communities are on the front lines of climate change, and they're uniquely sensitive to climate change impacts, due in part to their relationship with and dependence on the environment, but also due to historic and ongoing effects of colonization and an already greater existing burden of health inequities. It's also important to recognize that despite these challenges, First Nations, Inuit, and Métis peoples have been actively observing and adapting to climate change in a diversity of ways, and Indigenous knowledge systems and practices have really been critical for this survival and resilience, and of course have been very valuable for understanding and responding to climate change. Other population groups that are commonly identified as at increased risk of climate-related health impacts include seniors and children, people that are pregnant, people with chronic medical conditions, individuals with low socioeconomic status, racialized populations, and people with disabilities. I've touched on this a little bit just in the past slides, but again, just noting that vulnerability can also be influenced by one's living and working conditions and other social dynamics. And so depending on the health risks, there's again, different vulnerability factors and protective factors. So for example, in the case of extreme heat, some other intersecting vulnerability factors include individuals that may rent their home instead of own their home, those living in poorly designed and maintained dwellings, newcomers to Canada, those that are socially isolated, people with mobility challenges, and of course, your geographic location can also influence your exposure to various hazards. I also just want to again note that these groups are not homogeneous and vulnerability factors differ between and across population groups in society. So here is an example you may be familiar with. The 2018 heat wave in Montreal resulted in 66 deaths. One study found that of those that died, they were twice as likely to die when they lived in low-income neighborhoods that lacked air conditioning and experienced the urban heat island effect. So again, really just illustrating the fact that determinants of health influence health risks and outcomes of climate hazards. And these findings are very similar to the analysis of deaths that were associated with the heat dome that BC experienced last summer, where over 600 people died. So moving on to our next key message, just as the health risks of climate change are not experienced in the same way across society, neither are the outcomes of adaptation measures. And this is important because when adaptation measures are planned without consideration for health equity, the outcomes of those measures may only benefit some populations and could even inadvertently exacerbate existing inequities. So for example, increasing green spaces in an urban center can reduce health risks associated with urban heat islands and have a number of associated health co-benefits. But not everyone has access to green spaces. A study in Toronto, for example, found that low-income and racialized communities have less access to tree canopy cover and public green spaces compared to predominantly white communities. So developing new green spaces in communities and neighborhoods that currently lack access to them is a potential intervention to address this. But in some cases, green spaces have led to gentrification and increased property values in the neighborhood, which could lead to the displacement of low-income residents and small local businesses and contribute to the widening of health disparities. So these are the kinds of things we need to consider before implementing adaptation actions to ensure that we design measures to mitigate potential negative impacts. So in an effort to address the concerns with green spaces, adaptation plans may also involve instituting complementary policies. So for example, rent control policies and other strategies to maintain housing affordability, of course, prioritizing those populations that are most in need. And so this really reinforces the next key message of the chapter, which was health equity should be an important focus of climate change and health activities, such as vulnerability and adaptation assessments and related knowledge development activities. And so this is kind of in line with the national research that we've seen. So we do know local and regional health units are taking action to understand and reduce the health impacts of climate change. A survey in 2017 of health units across the country found that 35% of health authorities were in the process of or had already conducted a vulnerability and adaptation assessment. And those assessments are really considered the first step in the adaptation process. And so this work is continuing to increase. For example, you're likely familiar with the recent legislation in Ontario that mandates all health authorities to assess the health risks related to climate change in their regions. And of course, across Canada, this work is also increasing as awareness and concern for the health impacts related to climate change continues to grow. And so as we do this kind of work, we really want to make sure we're doing it in a way that centers health equity. A 2016 survey of Ontario health units found that those authorities, when they're developing measures to reduce climate change risk, 86% of respondents said that they consider the needs of populations at higher risk. However, only 37.3% said they consider implications for Indigenous peoples. Just over a quarter responded that they consider Indigenous knowledge and perspectives, and 17.9% consider sex and gender implications. So as our climate change and health response work continues, there's really a big opportunity for public health to center their climate change activities around health equity and social justice. And so there's a number of tools that can help to integrate health equity into our climate change work. And perhaps some of you are already familiar with these tools or resources. The examples on this slide have not all specifically been designed for climate change, but they can be tailored and applied to climate change activities and vulnerability assessments and other policymaking activities. And so I'll go through these briefly, just the general kind of categories of these tools, but would direct you to the chapter on health equity where you'll find more details and examples of these. So you're likely familiar with health equity impact assessments and sex and gender-based analysis tools. These are analytical tools that can be applied to the development of policies, research, and projects that help you assess how that project will impact health equity, either negatively or positively. Resilience and asset mapping can be quite an important tool. These are commonly community-based exercises that can identify people, organizations, spaces, and other intangible factors that contribute to community resilience. So these are things typically not captured in common sources of data. And so this is really taking a strength-based approach and understanding what assets exist in a community. And then decision makers can use that information to really understand where there are still gaps, where vulnerabilities exist, and the protective measures that may need to be enhanced or expanded. Similarly, vulnerability mapping provides information on social conditions and climate change vulnerability for a specific region. So they're typically based on an index that uses social vulnerability indicators, and that's overlaid on a map of biophysical impacts or projected climate change effects. And so, for example, Vancouver Coastal Health and their partners recently developed an index mapping project, which measures how susceptible communities are to health effects of heat, wildfire, smoke, and air pollution. And when you look at the maps, one can see that climate hazards really affect everyone, but disproportionately impact some neighborhoods. And so decision makers can use that information and that map to inform the allocation of resources and prioritize implementation of adaptation measures. I'm going to go into more detail on community engagement a little later in this presentation, but just want to recognize here that meaningful and inclusive engagement with community members, particularly those that are disproportionately impacted, can provide very helpful information on understanding vulnerability factors in a specific region and effective adaptation actions. So many of you may be familiar with the National Collaborating Center for Determinants of Health. I just wanted to take a moment here to highlight some of the work that they've been doing on climate change and health that may be of interest for you. So they've taken the established public health roles to improve health equity framework, and they've reimagined them to address climate change. So you'll see on the slide that there are 4 primary public health roles. So the first one, assessing and reporting on climate change impacts and related health inequities, modifying and orienting greenhouse gas mitigation and adaptation activities to reduce health inequities, partnering and collaborating with others to build climate resilient communities, and participating in policy development related to climate change. Again, this is discussed in more detail in the chapter, and it includes examples of different actions that can fit into each of these 4 roles as well. So again, just highlighting that public health has a role to play in not only addressing climate change, but they can do so in a way that supports and improves health equity in their communities. So our next key message is ensuring inclusive, equitable, and community-based participation in the adaptation process is really critical for designing and implementing effective adaptation actions. The chapter found evidence that an important component of ensuring that the outcomes of adaptation measures are equitable is to have equitable and inclusive participation in their design and development. And this is important because residents and community-based organizations, they have really important information that can not only help inform our understanding of the region's climate change vulnerability, but also what effective adaptation looks like. And in each community, effective adaptation may look different based on the existing assets, existing vulnerabilities, the existing social conditions. So there's not necessarily a one-size-fits-all approach to adaptation, which is why it is so important to really engage a diverse group of community members in the planning process. And again, the chapter provides examples of and case studies of some effective engagement, as well as tools and frameworks for effective engagement in your communities. And finally, the report found that adaptation measures, when planned with care, can promote health equity and or strengthen determinants of good health, which increases resilience to climate change. And this is important because when we implement adaptation measures, we want the outcomes of those measures to avoid just redistributing risk or shifting risk from one population to another, but to actually reduce vulnerability in general. So adaptation measures that can address these underlying drivers of vulnerability can be much more effective. And the chapter provides several examples of case studies of this, but I'll just highlight two here. So the Healthy Homes in Nunatsiavut is a really good example of adaptation actions that simultaneously strengthen determinants of health. So this was a project funded by Indigenous Services Canada. They have a climate change and health adaptation program. You'll see in the chat that there's a link to their report, and I encourage you to take a look at it because it documents and highlights all of the funded projects, and these are really great examples of Indigenous-led effective adaptation actions. So the aim of this specific project was to develop climate resilient housing infrastructure that was also culturally relevant, affordable, energy efficient, and reduce the health impacts of overcrowded dwellings and mold. So it was a really collaborative project. They had high community involvement, and important cultural values informed the design of the prototype multi-unit climate adapted housing development. And the design included space to store hunting equipment, a large steel sink for cleaning fish and preparing seal skins, and large open concept living spaces to allow for gathering. And these were all features that were proposed by the residents and then incorporated into the final design. So there were a number of outcomes of this project that support determinants of health and contribute to good health. So for example, the safe and climate resilient housing, of course, protects from exposure to climate hazards, and it also reduced the health impacts related to mold and overcrowding. But also the design of the home really supports engaging in traditional activities, which we know plays an incredibly important role in health and well-being. The other example on the slide here, the Nurses for Cool and Healthy Homes project, is a project in Fresno, California. So Fresno already experiences 92 days each year over 40 degrees Celsius, and climate scientists project that this could increase up to 30% by 2050. About 22% of the population live in poverty. The population is also very diverse. So racialized populations make up about 62.5% of the total population. And many of the poorest families live in crowded, low quality housing without air conditioning, and or they can't afford the energy costs associated with cooling their homes. So this project modified an existing nurse home visit program, and it equipped the public health nurses with knowledge and tools to help empower their clients to stay cool and healthy during extreme heat events. So they incorporated a heat risk assessment into the nurse home visits, and that included a checklist where the nurses were able to assess window conditions, the presence of air conditioners, any kind of barriers to paying utilities. And then the nurses could make energy assistance referrals and health referrals based on their client responses. So, for example, they provided their clients with information on heat illness, the symptoms of heat illness, and protective measures that they could take, and also make referrals for utility payment assistance and home energy improvement programs. And so this is, I think, a good example of we don't always have to reinvent the wheel when we're talking about climate change adaptation. In many cases, public health is already working in this field, and health equity is already a principal pillar of a lot of the work that we do. And so modifying existing programs can also be effective. So despite our best efforts to consider health equity throughout our adaptation process, there could still be unintended consequences or unforeseen negative impacts that result. Climate change adaptation measures, they're still relatively new. We're starting to see efforts ramp up, but we don't have a lot of research that's really monitored the impacts of adaptation measures long term. And we don't have very good understanding of how the outcomes of adaptation measures will impact health equity in the long term either. And so evaluating our climate change activities for impacts on health equity is really important. This will help to ensure that actions do not inadvertently exacerbate inequities or negatively impact parts of the population. And it can also provide information on if the measure is actually working and doing what it was designed to do and protecting who it was designed to protect. So the chapter on health equity in the assessment, it provides some of these emerging tools and frameworks that can help us with this monitoring and evaluation. So the evaluation framework on the slide is an example of this. This is a framework that can be applied to climate change adaptation measures in any sector, not just health. And it assesses the effectiveness of an adaptation measure by evaluating its effect on 7 domains that are related to determinants of health. So infrastructure, social factors, economic, community, environmental factors. And it also provides indicators and guiding questions to assist the user in understanding the positive and the negative implications of their adaptation measures. And so what's really important when we think about our kind of ongoing monitoring and evaluation of our activities is that it needs to be an iterative process. So as time goes on, you might notice that there are parts of the measure that need to be tweaked or reworked to make sure that we're really maximizing the benefits and minimizing any negative impacts. So before I wrap up today, I also wanted to highlight a variety of communications products that may be useful for you and your communities and your partners. So these are communications products that were also developed as part of the assessment report. The science assessment report is very technical. It's about 800 pages in length, so I recognize that that may not be of interest for a lot of folks. So we developed a variety of communications materials to also provide key messages to different audiences. So the National Collaborating Center for Indigenous Health, we were really, really lucky to work with this team. They authored Chapter 2 on the health of Indigenous peoples and climate change, and they also developed specific communications products for that chapter. So fact sheets and summaries. They also have a webinar series, and I believe are in the process of a podcast series right now. We also worked with ICLEI, a really great organization that helped develop a number of social media products. So these can be shared on your networks, on your social media networks. They can also just be standalone products that you share as PDFs or as images. We have several fact sheets and infographics, tweet cards, and other kind of images for each chapter. Those are free to use and they can be shared widely and publicly. And then finally, Health Canada, we also developed a number of fact sheets and executive summary. And what may be of interest for this audience is a number of briefing notes. So these are 2-page briefing notes that are targeted to specific audiences. And so, for example, we have a briefing note on the main findings of the report for practitioners, for public health officials, for health facility operators and administrators, and for decision makers outside of the health sector. And so again, these are really pulling out the important information that may be most relevant for those specific positions and that audience. And then my very last slide here is just to draw your attention to a recent report released by the Chief Public Health Officer of Canada, Dr. Theresa Tam, and that has a lot of relevance to what I've discussed today. So every year, the CPHO is required to develop an annual report on the state of public health in Canada. Last year's report was a flagship report and presented the vision to transform Canada's public health system based on lessons learned from COVID-19. And this year's report aims to put this vision to action and apply the recommendations from the 2021 report towards climate change. So it provides tangible recommendations for the role of public health in climate change and offers a public health policy frame and leveraging population health and equity approaches. And the report recommends action over three main themes. So the first is integrating climate considerations into public health systems, centering health and climate change action, and building a climate resilient public health system and workforce. So thank you very much. It was a pleasure to be here today and present the findings of the Health Equity chapter to you all. Here is my contact information, and please, I know we have a Q&A session after this, but should any other questions arise, feel free to send me an email. And with that, I'll pass it back to Elena.
Okay, this is wonderful. Thank you so much. We're now going to move to the Q&A pod to address some of the questions that have come up during the seminar. For those of you who are still typing, please don't hesitate to add your questions to the list, and we'll do our best to get to everything. Oh, so maybe I'll start with a very quick one. With respect to the source for some of the social media type resources, we have a question. What does ICLEI stand for?
That's a great question. ICLEI has been an organization that's worked in climate change and the sustainability space for a long time. I actually don't know what ICLEI stands for. And in fact, I think the name has actually changed so that their legal organization name doesn't match with the acronym, but encourage anyone on this presentation who does know what their name stands for, put it in the chat box if you know, but I'm sorry, I'm not familiar with the full acronym.
No problem at all. No need to apologize. I think we all get used to our acronyms. Okay, so perhaps the first question. So with respect to indicators, are you aware of any indicators that are currently being used by Canada or even other countries or the World Health Organization with respect to climate change and health equity?
Yeah, that's a great question. Right now, this is still an emerging kind of area in the field. I don't think there's a consensus on what indicators would look like. Internationally, I think there are examples of different nations using indicators to track this, but again, it's still an emerging research area. Right now, I think just in terms of adaptation in general, there's really two frames or approaches to understanding and measuring the effectiveness and the impact of adaptation measures. And the first one is just to our adaptation measures actually reducing vulnerability, and then our adaptation measures just mitigating the impact of specific climate risks. And so they're similar, but slightly different. And I think there's still not consensus in terms of, international experts on really what adaptation measures should do. But because of that, we see different indicators from different groups. I will mention in terms of what Canada is doing, just a couple of hours ago, the National Adaptation Strategy was launched, and there are indicators that have been proposed with that report. But with the launch of that report, there is a 90-day comment period where Environment Canada will be working with provinces and territories and other organizations to get comments on those indicators and get consensus across those other targets and measurements.
So thank you. And in other words, this webinar was perfect timing.
Yeah.
It appears. Okay. Moving on to the next question. So there is a comment and also a question around food systems. And so given that you are also working on that chapter of the most recent assessment, are there maybe some key messages you could share about the vulnerability of our food system around climate change?
Sure. Yeah, happy to. So one of the main findings of the food chapter was that the food system in Canada has vulnerabilities to climate hazards, and we've already seen impacts, and we expect those risks to increase as climate warms. And so when we think about the food system, the chapter is really kind of framed around the idea of food systems, including food production, food processing, food distribution, and food utilization and consumption. And if climate change hazards or indirect impacts of climate change, they can impact a variety of different components in each of those elements of the food system. And because the food system is so interconnected, that disruption in one part of the food system can cause disruptions in other parts. And so the main kind of call to action in moving forward is really developing climate resilient food systems and taking a systems approach to that. Recognizing that some of the challenges exist from also having a globalized food system, right? So our food system isn't just, narrow to our boundaries or Canada's borders, but impacts in other parts of the world can also be felt in Canada. And we saw that, or we've seen that right now with food prices. So Canada's National Food Price Report is an annual report by folks at Dalhousie University. And every year for the last 7 or 8 years, I believe, climate change has been identified as a significant contributor and driver to increasing food prices in Canada. And that's because we've seen, climate hazards or extreme weather events disrupting really important crops in other parts of the world, or food distribution sites or important ports for transporting that food.
Thank you for that. Being put on the spot and being asked to summarize a chapter is not an easy thing. That's fantastic. Perhaps, drawing, I'm just going to move down the list just for a moment, because there's a question that's come up, and I think it's very relevant to what you just spoke to. Could you maybe describe your thoughts on how One Health, so the concept of One Health, climate change, and equity are all related?
Yeah, absolutely. So I do not claim to be an expert in One Health, but from my understanding, climate change is absolutely a One Health issue. And when we think about One Health, it's really this understanding that the environment and the health of the environment, the health of humans, and the health of plants and animals are all really interconnected. And so taking a One Health approach is really making sure, again, that we're taking a holistic, really systems approach to understanding that we're not just specifically targeting any one specific kind of narrow focus or working in silos, but specifically around health and food, making sure that any kind of climate change response through mitigation and adaptation is making sure that we're going to be protecting and promoting and supporting the environment and animals and plants and humans. We wouldn't want to, protect humans at the expense of the environment and animals and plants, for example.
That's great, thank you. So for the next question, is there one single top priority that you could identify in kind of an action plan to improve equity?
That's a big question.
And maybe even top 3 if it's hard to pick one.
Yeah, I think with this chapter was very specific in the sense that there are a lot of upstream drivers of inequities that was just out of the scope of identifying, a path forward in this chapter specifically. But certainly that would be an area of future work where, because the evidence suggests that addressing underlying drivers of climate change and underlying drivers of climate change are very similar to underlying drivers of health inequities. So things like addressing poverty and, redressing other health inequities, increasing healthcare access, for example, and the quality of healthcare. All of these things may not look like, specifically addressing climate change, but together can increase climate resilience among Canadians. And so I think improving health in general and redressing those health inequities can be an important part of reducing vulnerability across the country in general, making us more resilient to climate change. And so that's one area that is not a focus of the chapter, but I think is certainly an area where we need to look at more. And then another one too that the chapter found kind of a knowledge gap, but would be important to address is data limitations or gaps in data that we have. And so especially when local communities or local, are looking for downscale data, in a lot of cases, we don't have data that can really help us center health equity into some of our work or understand existing vulnerabilities or existing health inequities. And so, even things just as simple as disaggregated data across sex, across gender, across race. And so, enhancing our data capabilities or monitoring could be really helpful to inform more effective adaptation as we move forward. And then the other one I think that is so important and is highlighted throughout the chapter is community engagement, and really making sure that those that are not traditionally part of a decision-making process or typically, included in these decisions are going to be included in the climate change decision-making process. And that's not just, a top-down, here's what we think this community needs to do to increase resilience. What do you think of this? But actually including the community right from the beginning. And there is some evidence of this already, where researchers have gone into a community and they had an idea of what needed to happen in that community. And then when they engage with the community, all of these new ideas came up where they had never even considered it before. And so I think we really have to recognize that local knowledge and that lived experience is so valuable when we're talking about climate change and health equity. And that can be challenging for some decision makers and some organizations and various levels of government, because meaningful inclusive engagement requires time and resources and trust with the community. So building those really, meaningful relationships, meeting folks where they are, recognizing power dynamics, power imbalances, and, past historic traumas, colonization, et cetera. And so that can be a challenging thing to do correctly, but I think it will really, transform adaptation as we move forward.
Amazing, thank you. So we do have quite a few questions, and I'm going to apologize in advance. We won't be able to get to everything. But in terms of the next one, what do you think public health's role should be in ensuring adaptations to build a more resilient health system? So health system overall.
Yeah, this is great. So first, I will say the World Health Organization is doing a lot of work in climate resilient health systems right now. They have a relatively new report of what this looks like and a process for kind of assessing your health system, and a checklist for helping to build climate resilient health systems. So definitely check that out. I think public health has a really great opportunity right now to be a leader in this field and to recognize that our health systems do contribute to climate change. I think in Canada, it's our health systems generate about 5% of greenhouse gas emissions in the country. And so we, have an opportunity to reduce our emissions and become create more sustainable health facilities, but also recognizing that our health facilities are typically that first line of defense when there are climate hazards and when we see extreme weather events, for example, and things like that. And so making sure that those systems are going to be able to operate despite those climate hazards that are becoming more increasing or more frequent and more severe. And so public health certainly has a role to play in doing that. But again, the assessment suggests that multi-sectoral collaboration is really going to make a difference. And so health working with or like other sectors like energy, like transportation, city planners, hospital and other like private health facility administrators, that kind of thing. It's really an all hands on deck approach, working at all levels of government across, all sectors of society. Again, Dr. Teresa Tan's report speaks, I think, more specifically to some of the recommendations that public health can take right now in health system resilience.
Great, thank you. Moving right along. Okay, well, this next question is actually quite close to my heart. Could you comment on how this knowledge could become part of education and professional development, not just for current public health practitioners, but the future practitioners who are currently students?
Yeah, I think this is a really important area and an area that we're seeing increasing interest. And it's being driven by youth specifically, I think. And we see a lot of students that are training to be health practitioners who are becoming more and more aware of the climate related health impacts in the country, and who are recognizing that there are gaps in their education in terms of addressing this. And so an important part of having a climate resilient health system, I think, is also making sure that our practitioners are up to date on, being able to identify and diagnose and treat health or climate sensitive diseases, for example, like Lyme disease, like West Nile disease that we're seeing, spreading into Canada and in different regions of Canada where it wasn't before, and where some health practitioners haven't needed to know that information, and now they do need to know that information. Of course, things like heat illness, where we're seeing a number of increasing areas seeing heat waves where normally it wasn't an issue. And so being able to identify heat illness and being able to treat it properly. So there's certainly a real need for this. And then including it in health practitioner education can be a really important component of that. And so at the federal level, we don't have a lot of jurisdiction in this, but we have been working with some organizations. There's a couple train the trainer programs out there right now, and modules, like online modules that health practitioners can take. I think we're also really cognizant that in the last 2 years, the health system has been quite stressed and overworked. And we recognize that there's a lot of education involved with health practitioners. And so we don't necessarily want to overburden. And so looking for ways where we can kind of mainstream this climate change messaging into existing education could be, a strong path forward.
Thank you. I think in the interest of time, we're just going to ask one more question. This one, in many times it's difficult to engage Indigenous groups and organizations and others who have equity disparities, because these organizations or these other organizations are seeking to consult them. So in 2022, they're often getting many polls and requests to contribute to work like this. Do you have any tips or information that would maybe support public health practitioners that are trying to engage with these types of groups and organizations?
Yeah, absolutely. I think that's a very valid concern. And I'm not an engagement expert, but the chapter does provide a number of reports and publications and frameworks the objective is meaningful engagement. And so I would direct you to look at those examples first, because I think there's some really helpful kind of approaches and clear steps there. I will also say there's some examples. So Portland, the city of Portland in Oregon, for example, they were developing a climate strategy for the city, and they decided to convene a equity kind of advisory group. And so instead of just inviting their traditional partners to, volunteer off the side of their desk, they made sure that they provided funding that would actually cover, provide that would recognize the time and the space that these people are using. And so that was, I think, as we move forward, we're making sure that we're providing capacity for organizations to actually participate in these processes, and recognizing that some may not have capacity to do so, but wherever we can, provide funding or other resources, at the local level. A lot of times when it's community-based engagement, there's free food that's provided, there's childcare, there's free transportation, whatever we can do to really minimize that impact on the folks that we are engaging with, because it is time consuming, and we have to show why their involvement is so valued. But again, my work does not typically involve actually engaging with folks. So I would point you in the direction of the chapter and to look at some of those frameworks and approaches that are written by experts on engagement.
Okay, thank you. And I think we do have time for one more question. I think with respect to the next question, when it comes to health inequities, I think some of the data you presented show that these have been long-standing issues. And so do you know of any work currently being done within Canada or beyond to address these types of inequities?
Yeah, so certainly I know that there's increasing recognition of the importance of some of these in terms of how it interacts with our climate change work. And so I'll give an example. Statistics Canada right now is in the process of I can't remember what they call it, but it's essentially collecting data on environmental racism, for example. And so understanding that process and what that looks like in Canada, where we're seeing it. And so again, kind of going back to my response around data collection and how important that can be, that will really help us have a better understanding, I think, as a nation of what environmental racism looks like, and how that can then be, identified and help inform our climate action moving forward. I work in the Climate Change and Innovation Office in Health Canada, and at FAC, the Infectious Disease Office. So I don't work specifically with, poverty reduction and stuff like that, but there are, of course, departments in the Government of Canada that specifically look at some of those underlying, social and health inequities. But I'm not well versed in, the specific plans of that. Moving forward, of course, an important part of federal adaptation to climate change in Canada is to work with those programs that already have, specific policies and mandates in place, and see how we can leverage those to complement any kind of climate change action that we're taking as well.
Okay, that's fantastic. And you've actually touched on another question we couldn't get to when you spoke to environmental racism.
Great.
Thank you for that. We do now have to wrap up, given the time. I just want to again say thank you to Rebecca and to everyone who joined us today. That this was a really great session and really, very comprehensive discussion following. For everyone who registered for today's event, please expect to receive a brief and anonymous evaluation survey. We do encourage you to please take a few moments to help us continue to improve these series. and for anyone who would like to assess this session after the recording of the session or the previous session that was presented by Dr. Peter Barry on the national report, they are available on our website. Today's session will be available in a few weeks. And you just have to head to the education and events section and then click on presentations to find that information. To everyone, thank you very much for joining today and have a wonderful afternoon.